This is Dr. Daniel Paull, orthopedic doc with Easy Orthopedics, and today I'm going to talk about the truth about jam fingers, what really happens inside the joint. If you like this video, we put out new content weekly, so please like and subscribe. So jam fingers, real easy to do, fingers straight, basketball, football, something, just jams it. That's how most people get it. I mean, you can obviously jam your fingers on anything, but it's not like your toe where you're walking around and you kick a toy or something like that. So what's going on in there? Well, if you were to get an x-ray, you really wouldn't see much. You might see some soft tissue swelling, but again, if you look at a finger, there's not a ton of soft tissue there, so you might not even see that. Obviously, if you see any fractures, then that's not a jam finger, that's a broken finger, different story. So what's happening is, when you have each part of the finger, or the knuckle on your different knuckles are getting smushed into each other, and that can do a few different things. One is it can sort of damage the cartilage ever so slightly, and when that happens, you just get a ton of fluid that comes out. Cartilage has lots of fluid in it that's stuck inside it, and when it gets damaged, it just sort of dumps it out, so it'll be swollen. It can also damage the ligaments depending on whether your finger got bent one way or the other, so you might have some small tears in those ligaments, nothing terrible, stuff that'll heal on its own, but you might find that in there as well. And then you also have the lining of the joint, which is called the synovium, and you have that in every joint, and that could just be inflamed, like the general capsule of the joint. So you could have cartilage damage that causes it swelling. You can have ligament damage that'll cause strains inside these ligaments that also causes inflammation, and then synovial swelling, which causes inflammation as well. And that's what it looks like when you jam your finger. Now, it's hard to tell what's what, right? It's just the whole thing hurts and there's no fractures, so we say it's just jammed. And for whatever reason, jam fingers can take a really long, when they're bad, they can take a really long time to go away, or for all the swelling to go. Pain usually goes away relatively quickly, but the swelling can take sometimes up to a year. The key is you just want to keep it moving so it doesn't get too stiff, assuming you don't have any fractures there. So I hope I was able to talk about jam fingers and any questions you might have and what really is going on inside there. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any specific medical advice over YouTube because this video and all my videos are for educational purposes only. Thanks for watching.